Hello, my name is Jesslyn Hendrickson.
My name is Sophie Chelsvik.
And my name is Emmeline Zaworski.
We are medical students at the Medical College of Wisconsin Central Wisconsin campus presenting an interprofessional education series called Medicine in Real Life that was developed by and for medical and social work students. We chose the project name Medicine in Real Life to highlight the importance of illustrating to preclinical students that medicine in reality is a complex, interdisciplinary effort that looks vastly different from the way that it is presented in lectures.
As medical students in our first year of medical education, we felt our education was lacking in applicable interprofessional experiences. To further our own education and benefit others to come, we created a novel, interactive interprofessional experience. Our purpose was to increase medical and social work student comfort with co-learning and collaboration on healthcare teams. Additional aims were to develop and measure growth of IPE competencies, including teamwork, communication, values and ethics, and roles and responsibilities.
We began by performing stakeholder interviews. Identified stakeholders included medical students, social work students, practicing physicians, as well as social work and medical educators. A total of 48 individuals were interviewed individually or in small groups. Figure 1 displays a histogram of those interviewed and their stakeholder categorization. Interviews examined interactions between physicians and other members of the medical team, how these interactions could improve, and social worker roles on the medical team. Additionally, stakeholders identified areas for growth within the current educational paradigm and suggested methods and considerations for implementation. These interviews culminated in the formation of an interprofessional content creation team consisting of 6 medical students, 1 social work student, and 1 social work professor. Next, we recruited participants. Social work students from the University of Wisconsin Stevens Point and medical students from the Medical College of Wisconsin Central Wisconsin were recruited for participation. Incentives included food at each session and Visa gift cards for $75 or less. Participation was voluntary and extracurricular. After recruiting participants, we conducted a series of 3 interprofessional sessions. Session 1 was a panel discussion. Social workers and physicians spoke about interactions between social workers, physicians, and others on the medical team. Speakers emphasized the roles and responsibilities of team members and how to effectively communicate given different knowledge bases. Session 2 was a simulated patient encounter. 2 medical students and 1 social work student interviewed a standardized patient together, collaborated to create a care plan, spoke with social workers and physician mentors for feedback, then presented their plan to the patient. Session 3, the final session, was a reflection. Participants collectively reflected on their experiences, discussed what they gained from participation, and provided feedback for future iterations.
Quantitative data was collected before and after IPE participation using a validated survey called the Interprofessional Collaborative Competency Attainment Survey, or the ICAS. Respondents were asked to rate their proficiency relating to each item on a 5-point Likert scale, with 0 being poor to 4 being excellent. Each item was coded to corresponding IPE competencies. Coded competencies included communication, roles and responsibilities, teamwork, and values and ethics. The ICAS acted as the foundation for both the pre- and post-surveys. The pre-survey was identical to the ICAS with 2 additions. The first addition was an item used to create a coded identifier used to match respondents' pre- and post-surveys for comparison, as the forms were completed anonymously. The second addition was an item using the existing ICAS Likert scale. The post-survey contained all items included in the pre-survey with 3 additional questions. 2 questions evaluated the student experience. The third was an open-ended question for any additional feedback. The full instrument can be found by scanning the QR code at the bottom right of the poster. After all sessions were complete, we analyzed the survey results. Pre- and post-survey competency and total scores were compared via paired t-tests with Bonferroni correction. Results with improvement at a significance of alpha less than 0.05 were considered statistically significant.
This cohort showed statistically significant improvement in all 4 IPE competencies as demonstrated in Figure 2. The average improvement per competency, adjusted by number of questions, was calculated to be 1.21 for communication, 1.29 for values and ethics, 1.40 for roles and responsibilities, and 1.43 for teamwork. The greater improvements in the teamwork and roles and responsibilities categories may suggest that the elements of our model were more closely linked to those particular competencies. In addition to comparing pre- and post-survey composite competency scores, further t-tests were used to compare improvements between the medical student and social work student cohorts. They showed a statistically significant average total survey improvement of 20.5 points for the medical students and 7.3 for the Bachelor of Social Work students. Though this indicates that both groups improved, it's important to consider the score discrepancy. Finally, optional free response comments provided by some participants indicated appreciation for the program model. Based on survey results and direct verbal feedback, the project's goals were achieved, and participants indicated that they found the experience to be valuable and worthwhile. Students reflected that they learned more about not only their counterparts' roles, but their way of looking at patients. Given the extensive overlap between these disciplines, medical students reported feeling that this felt more applicable and realistic than other IPE experiences they'd had. Additionally, participants felt more comfortable problem-solving together after having time to get to know each other and socialize. Of note, based on the difference in total survey improvement between the medical student and social work student groups, the project may have disproportionately benefited the medical students. This may be in part due to differences in self-assessment or differences in program curriculums and prior IP experiences. Given that the series was developed by medical students, it is also true that that lens influenced the content despite our close collaboration with Kate Kipp. Going forward, we intend to continue working closely with course directors at MCW-CW and with social work faculty at UW-Stevens Point to develop long-term relationships between the institutions and prepare to implement this series into the curriculum. We will continue to modify program design based on the feedback we've collected to maximize benefit to students of both disciplines. Finally, as we fine-tune the content and delivery, we will prepare standardized materials that will allow for faithful replication of this experience with future students.
We would like to acknowledge the Kern Institute for the Transformation of Medical Education for their guidance and recognize that this project could not have been possible without the Transformational Ideas Initiative grant awarded to our team. Special thanks to Julia Schmidt and Chris Decker at the Kern Institute. Further thanks to the rest of our team, including fellow medical students Eric Weaver, who kindly completed the data analysis, Megan Peterson, Eric Lee, social work student Annalise Berenz, and our social work professors Kate Kipp and Jess Bowers at UW Stevens Point, as well as all of our pilot participants. Thank you.